Why is Israel excluding Palestinians from its COVID-19 vaccine program? 2020 will be remembered for the coronavirus pandemic that infected more than 80 million people and left nearly 2 million dead. But now, there's a glimmer of hope.
The world's leading scientists have expressed their delight, along with a strong note of caution, following the news that a vaccine against coronavirus has proved 90% effective.
Multiple COVID-19 vaccines have been developed in record time, and mass vaccination programs are underway. One country that is being praised is Israel, which is rapidly inoculating its 9 million citizens. In the first week of this year, nearly 15% of its population has been immunized. It's being done so fast, they're running out of doses. Prime Minister Benjamin Netanyahu says that his country will be the first to emerge from this pandemic.
We will be able to go to soccer fields, to see basketball games, and of course, to reopen the country and restore it to what it was, to go back to the normal life that we desire.
By the end of January, the government aims to vaccinate more than 2 million people. That's including Israelis living in illegal settlements in the occupied West Bank. But for the Palestinians living there, well, they won't be as lucky. Rights groups are blasting Israel's vaccination program, which excludes the 5 million Palestinians under its occupation. Under international law, as an occupying power, Israel has a legal and humanitarian duty to help Palestinians. An occupier must ensure the adoption and application of the prophylactic and preventive measures necessary to combat the spread of contagious diseases and epidemics. This includes providing support for the purchase and distribution of vaccines. However, Israel has yet to announce any policy or even a timeline for any vaccines for the occupied territories. For now, Palestinians will have to rely on a World Health Organization-led program called COVAX.
The COVAX pillar aims to ensure that every country gets fair and equitable access to eventual COVID-19 vaccines. It does this by acting as an insurance policy, with the largest portfolio of vaccine candidates in the world.
It aims to inoculate at least 20% of a country's population, but that could take months to get off the ground.
So far, we cannot say that the vaccine will arrive within a week, 10 days, 2 weeks or a month, because the WHO and Gavi Alliance have said that these doses will be distributed to us sometime in 2021. But we are hoping to get the vaccine as soon as possible.
And what about Gaza? The pandemic has taken its toll on a fragile healthcare system already on the brink of collapse.
Gaza's declining healthcare system is ill-equipped to handle a pandemic outbreak. The territory has fewer than 3,000 hospital beds, roughly 1 for every 1,000 Palestinians, and only 50 or so life-saving ventilators.
The 14-year siege of the enclave is also making matters worse. There's not only a shortage of food and electricity, but also life-saving medical supplies and facilities. And security threats have been plaguing the largest open prison in the world for years. In the 2014 war with Israel, 73 medical facilities were destroyed, and efforts to rebuild Gaza's health infrastructure were hampered by import restrictions imposed by Israel.
Israel says the siege is necessary for security reasons, but the UN calls it collective punishment. There are severe restrictions on who and what can enter or leave the Strip.
A COVID-19 vaccine will surely help alleviate an imminent crisis in Gaza, but there's no way of knowing if Palestinians will receive relief anytime soon, or when Israel will live up to its legal obligations. And as people in Israel celebrate the rolling out of vaccines, Palestinians will just have to sit and wait.